At 72, Evelyn Carter from Florida has always believed that prevention is better than cure. Every year, she faithfully goes for a full medical checkup. X-rays, bone density scans, complete blood panels, thyroid tests, heart exams, cancer screenings, even MRIs, despite feeling perfectly fine. She thought, the more I check, the safer I am. But one day, after a possible abnormality showed up on a lung X-ray, she was advised to get a CT scan. The result? Nothing serious. Yet that single scan exposed her to a radiation dose nearly 100 times higher than a standard chest X-ray. Her doctor said it was harmless, but a few months later, Evelyn began losing sleep, feeling anxious, and constantly sensing that something inside her wasn't right. Evelyn's story is far from rare. In the United States, a Harvard Medical School study found that nearly 42% of people over age 70 undergo at least one unnecessary medical test each year. And 1 in 3 of those tests leads to avoidable or even harmful interventions, such as biopsies, strong medications, or surgery. This is the paradox of modern medicine. The more advanced our technology becomes, the more anxious people feel about their health. And sometimes, the fear of illness becomes an illness in itself. After 70, the human body changes, slowly but surely. Cells regenerate more slowly. The body reacts differently to medications, and both physical and emotional resilience decline. Each medical test, each possibly abnormal result, each follow-up appointment can become a new source of stress. Imagine this. A 75-year-old is told by her doctor, "We found something unusual. We'll need to do more tests." That single sentence can mean weeks of sleepless nights, waiting for results. And many times, that abnormality turns out to mean nothing at all. Just a natural change that comes with age, requiring no treatment. Dr. Rita Redberg, a cardiologist and professor at the University of California, San Francisco, once said, "After 70, the goal isn't to find more disease, it's to avoid creating disease where none exists." That's why more and more American doctors now encourage selective testing instead of comprehensive. Once shared his experience on PBS Frontline. "I had over 10 tests in 1 year. Every time the doctor said, 'We found something. We need to check further.' Each time meant another sleepless night. Now I realize I don't need to look for everything inside me. I just need to feel life more clearly." Robert's words struck a chord with many. At 70, true health isn't only measured in lab results, it's found in peace of mind, good sleep, emotional balance, connection and joy. But few people stop to ask, am I really taking care of my health, or am I becoming a victim of my fear of illness? In the US, the healthcare system is among the most advanced in the world. Many believe, if I can test early, I should. But leading organizations like the US Preventive Services Task Force, USPSTF, and the American Geriatric Society warn that some medical tests may do more harm than good if performed too frequently or on the wrong patients. They call this phenomenon overdiagnosis, diagnosing conditions that would never cause harm. A small lump, a faint shadow, or a minor variation in a lab result can trigger a cascade of follow-ups, appointments, biopsies, treatments, anxiety, when in reality, the body may be perfectly healthy. If you've ever felt that anxiety, the long wait, the sleepless nights, the fear of what a test might reveal, share your story below. Your experience might help someone else feel less alone. And if you find this topic meaningful, subscribe to New Golden Day. Here, we don't just talk about aging. We learn how to live with calm, wisdom, and grace at every stage of life. Dr. Michael Andrews, a diagnostic imaging specialist at the Mayo Clinic, once shared that he often meets older patients who come in for CT scans or MRIs simply because they want to make sure everything is fine. But he also admitted a sobering truth. Roughly 30 to 40% of those scans are completely unnecessary. A modern CT or MRI machine can detect the tiniest of changes, a speck of calcium, a slightly thickened tissue, a faint irregularity in the brain, lungs, or liver. But not everything unusual is truly abnormal. By the age of 70, the body has undergone millions of cycles of cell regeneration, decades of stress, infections, bumps, and medication. Tiny bright spots or mild scarring in imaging results are perfectly normal at that stage of life. Yet when those images fall into the hands of a worried patient, they become red alarms. A 74-year-old woman named Mrs. Peterson told the New York Times, "I had an MRI just to check my back because of mild pain. The results said there was a suspicious area. I spent 3 weeks terrified, had 2 more scans, and finally, the doctor said everything was fine. But during those 3 weeks, I barely slept." Beyond the thousands of dollars in costs, it's the anxiety that becomes the real toxin, raising blood pressure, straining the heart, and disturbing sleep. What many people don't realize is that a CT scan uses X-rays at a radiation dose up to 100 times higher than a standard chest X-ray. For older adults with weakened immune systems, repeated radiation exposure can damage cellular DNA and, in rare cases, increase the risk of secondary cancers. According to the US National Cancer Institute, an estimated 2% of all cancer cases in the country may be linked to medical radiation. That number may sound small, but when you consider that people over 70 undergo scans 4 to 5 times more often than younger adults, the cumulative risk becomes significant. MRI scans, while free of radiation, often require the use of contrast dye containing gadolinium. For those with reduced kidney function, the dye can build up and, in rare but serious cases, cause a condition called systemic fibrosis, making the skin and muscles stiff and difficult to move. At 70, even a simple recommends a biopsy. The biopsy shows a minor lesion, no treatment needed. But afterward, the patient develops an infection and spends 4 days in the hospital. From a healthy person to a hospital bed, all because of a test done just in case. There's an old saying among American seniors, "You can't scan your way to peace of mind." It sounds gentle, but it's deeply true. A good doctor isn't the one who prescribes the most tests or treatments. A good doctor knows when to stop and helps you understand that real health doesn't live on a lab report. It lives in your daily rhythm, your calm, and your ability to listen to your body. There are, of course, 3 situations when doctors do recommend tests for older adults. When clear symptoms appear, like ongoing chest pain, coughing up blood, sudden numbness, or unexplained weight loss. When a serious urgent condition is suspected, such as a stroke, brain injury, or blocked artery, and when a known condition requires monitoring to guide treatment. But outside of those cases, most US medical organizations agree, better to watch your habits than to chase your scans. Evelyn, from the story earlier, said after going through numerous tests, "I realized that real peace doesn't come from a negative test result. It comes from living fully each day." Her words left many young doctors silent, because sometimes what a patient needs isn't another test result, but a conversation that helps them understand. They're still okay. And remember, if you found this message helpful, subscribe to New Golden Day, where we learn to live wisely, without fear, without excess, just right for life after 70. In America, people often say, "Early detection saves lives," and it's true, but only sometimes. After age 70, that phrase can become a double-edged sword. Dr. Otis Brawley, former chief medical officer of the American Cancer Society, once spoke candidly. "We've made millions believe that early detection is always good. But in many cases, it doesn't save lives. It only causes unnecessary suffering." Take prostate cancer, for example. Most men over 50 in the US are familiar with the PSA test, a simple blood test used to detect signs of prostate cancer. But according to the US Preventive Services Task Force, USPSTF, routine PSA testing after age 70 is no longer recommended because the risk of overdiagnosis, detecting harmless cancers, is too high. In reality, about 60% of prostate tumors found after 70 grow so slowly that they would never cause harm during a man's lifetime. But once discovered, many patients are pushed into invasive procedures, biopsies, surgeries, radiation, resulting in urinary problems, loss of sexual function, and depression. Dr. Richard Ablin, the scientist who invented the PSA test, once admitted in an interview, "We are killing people in an attempt to save them from a disease they would never have died from." One man, Walter Green, 75, from Ohio, is living proof of that tragedy. During a routine checkup, his doctor noticed a slightly elevated PSA level. A biopsy followed, showing low-grade cancer. Even though his doctor advised simple observation, Walter chose surgery for peace of mind. Afterward, he developed complications, loss of bladder control and impotence. "I didn't die from cancer," he said tearfully. "I died slowly from fear and from what it took away from my life." His wife Margaret shared that after the operation, Walter was never the same. He stopped walking the dog, stopped playing his guitar, stopped smiling. She said, "We lost our happy old age, all because of a test that never needed to be done." The same happens with women, through breast and cervical cancer screenings. According to the National Cancer Institute, women over 74 are generally not advised to get annual mammograms, unless they sounds appealing, but many doctors call this fear-based marketing. Most of the abnormalities these screenings find have no real clinical meaning, but they lead to endless follow-up tests, high costs, and long-lasting anxiety. A report from the Journal of the American Medical Association, JAMA, found that 1 in 3 patients over 75 undergo unnecessary cancer screenings, while only 1 in 10 of those cases actually requires treatment. That means for every 10 people screened, 9 endure fear, pain, and expense without any real benefit. A 2021 Yale University study reached a similar conclusion. Excessive screening does not extend life in older adults, but it does reduce its quality. By the time you reach 70, what matters most is not having more test results, but having a doctor who truly understands you. Dr. Sharon Inouye of Harvard once said, "Health in old age is about balance, knowing when to do more and when to stop, when to test, and when to simply listen to your body." A sincere conversation with your doctor about your goals, your values, your quality of life can be more valuable than dozens of expensive tests. If you've ever found yourself or your parents doing too many tests out of fear of missing something, pause and share that story in the comments. Your experience might help someone else avoid an unnecessary procedure. And if you found this video meaningful, subscribe to New Golden Day, because each week we bring you real stories so you can not only live longer, but live peacefully and joyfully. At 45, every time you visit the doctor, you'll likely hear the same advice. Keep your cholesterol below 200, blood sugar under 100, blood pressure under 120/80. But at 70, if you're still chasing those same numbers, you might actually be working against your own body. Dr. Louise Aronson, a geriatric specialist at the University of California, once said something memorable. "An older body isn't a faulty copy of a young one. It's a completely different design." And she's right. After 70, metabolism slows down. The liver and kidneys process drugs differently, and the heart and blood vessels lose some elasticity. That means the ideal numbers designed for people in their 30s or 40s no longer fit the aging body. The irony is, many older adults still become obsessed with hitting those same targets: cholesterol, blood sugar, blood pressure. taking 5 to 7 medications a day just to chase a version of perfection that modern science is now questioning. A large study by the American Geriatric Society found that more than 60% of Americans over 70 are taking at least one medication for blood pressure or cholesterol that they don't actually need. That happens because too many doctors still treat the numbers instead of the person. For example, at 45, a blood pressure of 140/90 is considered high, but at 75, that same number can be perfectly normal. The arteries are less flexible, and forcing pressure too low can lead to dizziness, falls, or even small strokes caused by reduced blood flow to the brain. The same goes for cholesterol-lowering statins. They may help prevent heart disease in middle age, but after 70, long-term use can increase the risk of muscle pain, mild memory loss, and liver strain. Dr. James Wright from the University of British Columbia once said, "After 70, the goal isn't the lowest cholesterol, it's the best quality of life." Many seniors with type 2 diabetes have lived with it for decades. When they see their blood sugar fluctuate, they panic and try to force it down. But a study from the New England Journal of Medicine revealed, for older adults, low blood sugar, hypoglycemia, is more dangerous than slightly high blood sugar. A single hidden side effect: emotional exhaustion. Medicine may extend life, but fear can take away the meaning of those extra years. Major U.S. medical associations like the American Diabetes Association, ADA, the American Heart Association, AHA, the American Geriatric Society, AGS, now share a new philosophy. After 70, targets should be flexible, not rigid. Here's what that means. Ideal blood pressure, 130/150/80/90, instead of 120/80. Fasting blood sugar, 100 to 140 milligrams per deciliter, instead of under 100. LDL cholesterol, under 130 is good enough. You don't need to push for 70 like younger adults. This doesn't mean neglecting your health. It means working with your body, not against it. Learning to live in peace with what it needs today, not what it used to be. In Japanese medicine, there's a philosophy called Chowa, which means harmony. The Japanese don't talk about controlling blood pressure or fighting diabetes. They talk about balancing the body. At 70, health isn't a battle to defeat disease. It's a journey to restore balance. Sometimes, a morning cup of tea, a gentle walk, and a good nap in the afternoon are worth more than a handful of pills. At 73, Linda Myers from Colorado took great pride in how well she cared for her health. She ate clean, practiced yoga, and took long daily walks. But during a routine checkup, her doctor suggested a DEXA scan, a bone density test to catch osteoporosis early. The results showed osteopenia, a condition where bone density is lower than normal, but not yet osteoporosis. The doctor immediately prescribed her a bone-strengthening drug. Linda followed the advice faithfully for 2 years. Then, one morning, she was rushed to the hospital with severe stomach pain. An endoscopy revealed serious ulcers, side effects of the medication. Her gastroenterologist told her, "You probably only needed calcium, vitamin D, and daily walks, not such a strong drug." Linda's story is not unusual. According to the American Geriatric Society, more than 10 million Americans over 65 are diagnosed with bone loss, osteopenia, every year, and over 40% of them are prescribed medication they don't really need. What's often overlooked is that the DEXA scan, the tool used to measure bone density, was originally developed using data from healthy white women in their 30s. So when a 70-year-old's bones are compared to that youthful baseline, the result almost always comes back as low. That's what experts call the numbers trap. In 1994, the World Health Organization introduced the term osteopenia to describe bones that are weaker than average, but not yet osteoporotic. The intention was to help doctors monitor at-risk patients, but soon it became a billion-dollar treatment market. Pharmaceutical companies began promoting drugs that promised to rebuild bone and make you as strong as you were at 30. In reality, medications like bisphosphonates, alendronate, risedronate can increase bone density, but not flexibility. This means bones may become thicker, but also more brittle, and more likely to fracture under stress. A 2015 New England Journal of Medicine study reported, after 5 years of bone density medication, the overall risk of fracture does not significantly decrease, and in some patients, it actually increases. As we age, losing some bone mass is completely natural, but the body adapts. Muscles, tendons, and ligaments compensate to make Greek yogurt build muscle, which supports bone structure. 3. Weight-bearing exercises. Walking, climbing stairs, light weightlifting, or practicing Tai Chi strengthen both bones and balance. A study from Tufts University found that seniors who walk 30 minutes daily reduce their risk of hip fractures by 40%. Major U.S. health organizations, including the National Osteoporosis Foundation and the American Geriatric Society, recommend first DEXA scan at age 65 for women, 70 for men. Repeat only every 3 to 5 years unless symptoms or risk factors change. If you're already on osteoporosis medication, retest after 2 years to assess effectiveness. If you're over 75, have no fracture history, eat well, and stay active, frequent scans are unnecessary. In Okinawa, Japan, home to some of the world's longest living people, seniors rarely get bone scans. They don't say, "I need to check my bones." They say, "I need to walk with my friends." They eat small whole fish, tofu, and vegetables, drink green tea, and enjoy the morning sun. The result? The rate of hip fractures among Okinawans over 80 is only 1/3 that of Americans. They understand something simple yet profound. Bones need more than calcium. They need laughter, light, and movement. If you or someone you love is taking osteoporosis medication or worried about a DEXA scan result, share this video with them. Sometimes, all they need to hear is that numbers don't define their health. And if this message resonates with you, subscribe to New Golden Day, where we learn to slow down, live wisely, and appreciate our bodies a little more every single day. Robert Hughes, age 76, from California, still remembers the day he decided to get his heart checked. Just to be safe. He felt healthy, walked every morning, and only occasionally got winded climbing stairs. His doctor recommended a stress test, a treadmill exam that monitors heart rate, blood pressure, and ECG activity during exercise. The result showed a minor abnormality. His doctor then suggested a CT angiogram, followed by a dye-based angiogram. Soon after, Robert had a stent placed, purely as a preventative measure. 2 months later, he developed a stent infection and spent nearly 2 weeks in the hospital. When he later consulted another cardiologist, the doctor said, "If you didn't have chest pain or serious symptoms, you probably didn't need that stress test in the first place." That moment stayed with Robert for a long time. He realized that sometimes what hurts the heart isn't disease, but fear. At 70, the heart doesn't beat like it did at 30, and that's completely normal. The heart muscle thickens, blood vessels stiffen, and the rhythm slows slightly. Yet many older adults panic when they hear phrases like a mild murmur or an irregular beat, rushing to undergo every possible test. Electrocardiogram, ECG, echocardiogram, stress test, CT or MRI of the heart. These technologies were designed for people with serious or symptomatic conditions, yet they're now often used as routine checks for healthy seniors. Dr. Rita Redberg from the University of California warns, "When you test a healthy heart, you will always find something, but that doesn't mean it's a problem." And that's the danger. A single, suspicious result can trigger a chain of expensive and risky medical interventions. A stress test measures how well blood flows to your heart during exercise. It's valuable if you have real symptoms, chest pain, shortness of breath, or irregular heartbeats. But if you're otherwise healthy, doing one just to be sure brings risks such as false positives. The test suggests a problem when there isn't one. Unnecessary procedures, like angiograms or stent placements. Psychological stress, worry, anxiety, and increased heart rate. The very things you're trying to avoid. A study in JAMA: if your heart races while walking, stop, breathe, drink water, rest. If climbing stairs makes you tired, check your blood pressure at home before rushing to the ER. If you feel chest discomfort that eases after resting, it's often muscle tension, not a heart attack. The key difference between a natural reaction and a dangerous symptom is something a good doctor helps you understand. According to the American Heart Association, AHA, after 70, you only need heart tests if you experience clear symptoms: chest pain or tightness during exertion, ongoing shortness of breath, swelling in the legs, dizziness or fainting, abnormal heartbeat while at rest. If you don't have those signs, focus instead on heart-healthy habits. Eat less salt and refined sugar. Walk or swim gently every day. Stay hydrated. Get deep sleep and make time to relax. Those do far more for your heart than any ultrasound image ever could. Dr. Ellen Grant, age 81, a retired cardiologist from New York, wrote in her memoir, "After I retired, I never ordered another test for myself. I just check my blood pressure at home, take walks, and laugh often. My heart has never felt stronger." When asked her secret, she smiled, "I listen to my heart. I don't ask machines to interpret it for me." At 70 or 80, your heart doesn't need to be perfect. It simply needs kindness, patience, and understanding. Don't let numbers or scans convince you that you're weak, because in truth, your heart is still strong. It's just aging naturally, as it was always meant to. Over the past half-century, medicine has reached heights once unimaginable. We can now look into individual cells, map every blood vessel, and use artificial intelligence to predict disease risks before symptoms even appear. But the great paradox of our age, the truest irony, is this: the more we understand the body through machines, the more we lose touch with the quiet wisdom of our own senses. Ask a young person what health means, and they'll say, "Health is having no illness." Ask someone over 70, and they'll smile softly. Health is still wanting to live. After 70, health is no longer a race against numbers. It is the harmony between body, mind, and spirit. It is the ability to walk slowly, eat with gratitude, laugh easily, and sleep deeply, without worrying about tomorrow. Yet in a world filled with fear and advertising, many older adults are made to believe that unless they keep testing, screening, measuring, and medicating, they're in danger. But the truth is that fear itself can harm faster than any disease ever could. Dr. Atul Gawande, author of Being Mortal, once wrote, "The goal of medicine is not simply to extend life at any cost, but to help us live well in the time that remains." Across America, more doctors are beginning to shift their focus, from chasing perfect numbers to asking deeper, gentler questions. What still brings you joy each day? How do you want to live, not just how long? If you could choose, what would your mornings look like? This is what compassionate medicine looks like, the kind that listens before it treats. The human body is not a machine. It is a living, self-balancing organism. Give it time and it will heal. Let go of fear and it will find peace. Studies have shown that calming anxiety can naturally stabilize blood pressure. Good sleep strengthens immune cells more effectively than most supplements. Laughter releases endorphins, reduces inflammation, and eases pain. In other words, true health is not the result of constant testing. It is the outcome of a meaningful life. On a quiet porch in Sarasota, Evelyn Carter, The woman who once took too many medical tests has changed her ways. She still visits her doctor, but only when necessary. Each morning she carries a chair outside, closes her up, needs kindness, patience, love, and understanding. No medical test can measure the joy of sitting beside your grandchildren. No CT scan can detect the kindness shining in your eyes. No MRI can capture the peace you feel watching the sunrise, listening to birdsong. Because health, at 70, 80, or 90, doesn't live only in your heart, liver, or lungs. It lives in how you see the world, how gently you smile at yourself, and how fully you recognize that every morning you wake up, still breathing, still alive. That alone is a miracle. If you've ever gone through unnecessary tests or felt anxious because of numbers on a report, share your story below. Someone watching this video might be feeling the same fear, and your words could help them find peace. And if you believe that health comes not only from hospitals, but from how we live, love, and slow down, subscribe to New Golden Day. Each week, we share stories and insights to help you understand yourself more deeply. Because turning 70 isn't the end of the story. It's the beginning of a new chapter, one of wisdom and serenity. Don't be afraid of growing old. Don't believe your body is betraying you. It's simply reminding you to slow down, to listen, and to give thanks. And when you can do that, you no longer need a test to prove your health, because you'll feel it, quietly and powerfully, right within your heart.